I'm Ashraf. This is election year in the United States of America. With every passing day, we are getting closer to the election day, a day when one of the candidate will win presidential election and lead the nation for next 4 years. There are several candidates on Democratic side and there are several candidates on Republican side. They all are discussing national issues on their party platforms. Right now, the discussions are going on both sides on among their own candidates. Democrats are discussing those issues with their Democratic rivals, and Republican candidates are discussing issues with their own rivals within their own parties. Once a candidate emerges on each side and we enter into the presidential race between the two parties' nominees, then they will discuss the national issues in the light of their party policies. When I hear their arguments on different issues, I start thinking whether they really discuss the real nature of issues. For example, on both sides, Republican and Democratic side, the candidate discuss health care plans. On Democratic side, Bernie Sanders and Hillary Clinton, they talk about the various issues about the healthcare system. In Republican Party, Mr. Donald Trump and Ted Cruz and Marco Rubio talk about the healthcare issues. There is thinking on a Democratic side and there is a thinking on Republican side. Both talk about Republicans talk about the prices of healthcare plan. They say the prices should be affordable and everybody should be able to afford the uh, price of the healthcare plan. On Democratic sides, candidates think this should be a universal healthcare plan and it should be it should be financed in such a way that patient should have a healthcare plan without thinking much about money, and it should be funded through different sources and people should be taxed that to finance healthcare plan through taxation. But is it the real issue? I think no. In healthcare, the real issue is never discussed in any election. It hasn't been discussed before and it is not being discussed even in this election. I think the real issue in medical system in the United States is the ability of medicines to cure the diseases and the ability of the medicines to manage the diseases. At federal level, there is an agency which is called Federal Drug Administration. It is Federal Drug Administration which approves the medicines which patients get through the health care networks. When they fall ill, they go to their doctors through the healthcare plans they have, and then doctors prescribe them the medicines which they get from pharmacies pharmacies of those healthcare networks are private pharmacies. All serious diseases, they are not cured, they are managed. This is the real issue. Why FDA approves the medicines which manage diseases instead of curing diseases. Nobody discusses this thing. And I watch advertisements on TV networks of different medicines. Let us say, for example, diabetes. Various companies which make various tablets for diabetic patients, they advertise about their medicines which can manage diabetes. When they advertise those medicines which they develop after a long research and putting in a lot of money, they just talk about the one benefit of that medicine, that it will manage the diabetes, manage the disease, but they talk about 20 other side effects of that medicines. And normally those side effects are, if somebody has diabetes, he is going to have those side effects of diabetes itself. So what is the use of that medicine? If somebody is going to have kidneys infection because of diabetes, and the side effect of that medicine is that patient will have kidneys infection, or if he has problem with his kidneys, he should not take that medicine. So what is the use of that medicine? I think this is a charade which should be addressed by presidential hopefuls, by presidential candidates, and voters should demand from them that they should look at the FDA's policies and regulations to approve the medicines in this countries. Voters should know that they do not need the medicines which just manage their diseases. They need the medicines which cure their diseases. Why do they get the medicines which manage their diseases? Because there are so many pharmaceutical companies behind that which develop those medicines and sell those medicines. So if a person, if there are, let us say again, diabetes, there are about 15 million diabetic patients in the United States. If one person take 2 tablets a day and each tablet cost 50 cents, it means $15 million go in the pocket of that company every day. This is a rip off. This is no healthcare system. The voters should know that they need a medical system which cures their diseases, which does not manage their diseases. I am very confident that scientific developments have made human beings capable to develop medicines which can cure those diseases instead of managing them. And these presidential hopefuls who discuss the medical plans, they should discuss the real issues that medical system is facing in this country. And the real issue, the real challenge is not managing the diseases. The real challenge is to cure the diseases. And they have to talk about the FDA's policy. They should let the voters know what are they going to do about FDA's this policy, that FDA will not approve any medicine which will only manage the disease. They should ask FDA that once they become the president, they will make the law that FDA will only approve the medicines which will cure the diseases, which will not manage the diseases. The citizens of the United States, the patients who fall ill and go to those medical networks to have their diseases addressed. They should not be given the medicines approved by FDA, which just manage their diseases. They deserve much better than that, and this is the real issue. Affordability is not the issue, and universal healthcare plan is not the issue. The real issue is the curability of the medicine and the management of diseases. And the voters should demand that they want the medical system which can cure their diseases, not manage their diseases. Any presidential candidate who will address this issue is discussing the real issue. The other, all issues related to medical plans are the fake issues. They are not the real issues. And the voters should not get carried away with these discussions that this candidate is better or the other candidate is better. I'll give my input about these elections on other policy matters also in my other recorded uh, thoughts. Thank you very much for giving me time and listening to me.